Hello, everyone, and welcome back to the latest in our 15 Minutes web series. We are joined today by a great friend of the Chamber. He's a former past chair, in fact, of our board of directors, Mr. Jim Shanks. He comes to us from Park Place Behavioral Health, and we're going to learn a little bit about what his agency does and celebrate the fact that May is a National Mental Health Awareness Month. So hugely important throughout the year, but really focused here in May, and especially coming out of the recent soon to end, hopefully, COVID-19 pandemic. So lots of ground to cover in the 15 minutes today, and Jim's the expert, and so we're going to turn right to him. Jim, welcome, and thanks for being with us.
Okay, thank you for having me.
Yes, sir. So I'd like to learn a little bit more about community health agencies, where they've come from, maybe some of the history, and how you kind of navigate the waters here in Osceola County.
Yeah, just a very quick history on this. If you go back into the 70s, the way mentally ill people were treated were in state hospitals. There were state hospitals all over the state of Florida. Generally speaking, they had a bad reputation. They felt the care was not good, that people were abused, and they were very expensive. And the decision was made to let's try to move the people back to their communities where they have family or friends, and we can pay for it if we close these large mental health hospitals. There's still a few of them around, and occasionally we have to send somebody there. But that was back in the 70s. Park Place was chartered in 1976. And in most mental health agencies, every county in Florida doesn't have a mental health agency. The smaller counties are usually taken care of by a larger adjacent county. But the approach for a mental health agency is to broaden and expand and provide as many services as possible. We're not a hospital, okay? There are still large hospitals around the state. Most of the hospitals are investor-owned hospitals or for-profit hospitals. Mental health agencies are pretty much all nonprofit agencies. Now, I don't have any problem with for-profit agencies. I think I worked for a company for 30 years and ran for-profit hospitals, but I think sometimes the investor-owned hospitals they have a little more. They're more entrepreneurial. They'll try things that others won't. So I've tried to bring that with me to the nonprofit sector, by the way. But we've been here, like I say, since 1976. We provide inpatient care. It's not hospitalization, it's crisis stabilization. Mm-hmm. And it's almost like you might say an emergency treatment for somebody who's undergoing a severe psychotic episode, or somebody who is actually with a mental health disease, who's actually in a down period. They're thinking of harming themselves, mm-hmm. or maybe being a danger to the rest of the family. So they can be Baker acted is the term. Most of our adult Baker Acts are brought to us by law enforcement. And I would say if there's someone in your family or a close relative that you're very concerned about, you might want to think about calling the sheriff's office or the police department and have them brought to us. We can only keep someone in a crisis unit for 72 hours, but they hold court twice a week at Park Place with a magistrate. And if our psychiatrist is not comfortable letting somebody go, discharging them, their stay can be extended. Mm-hmm. So, and then we have an outpatient clinic, so we can tie them into the outpatient clinic and they can be seen there. Mm-hmm. We also have services for substance abusers, and that's unfortunately getting quite busy as well.
Sure. So let's talk a bit about this. So insurance or no insurance, people can check themselves in, or again, law enforcement, if the family mm-hmm. deems it a crisis situation, law enforcement will bring you your clientele. Talk to us a little bit about COVID-19 and kind of how you endured that. And then, are we out of that? Is life getting better, or are we still watching and keeping guard against mental health crisis here?
Well, I think it's getting better. I really do. The funny thing about the pandemic is during the pandemic, which is during our last fiscal year, our outpatient business just almost went to zero, not zero, but it got very low. Now the inpatient unit, clients being brought to us by law enforcement or children being sent from the school to us, that stayed pretty constant. But our outpatient clinic, just people were afraid to come in. I really think the media kind of created some of the problems by so much fear mongering, but people just wanted to stay in their house and they did want to come out. But it's interesting that even my board members would say, how come everything is so low? Because every time I pick up the paper, I read an article about how messed up everyone is and how mental health is such a big issue. And that's true. But in my personal opinion, I think during that period of time, people maybe had bigger issues to deal with, like, will I have a job next month? How am I going to put food on the table? So seeing a doctor wasn't at the top of the list. We're coming out of that now. We're in a new fiscal year, and we are exploding. As a matter of fact, we're trying to hire more psychiatrists and nurse practitioners because we're having a hard time keeping up with it right now.
And so you talked a little bit about substance abuse. And so, if there are experts out there looking for a great job opportunity, we'd like to introduce you to Jim and connect you. But, those are obviously related.
Well,
right?
yes. Well, that was really one of the pitfalls of the pandemic. People got very nervous. Drug use went up. And nowadays, drug use is a major issue. We used to think of a heroin addict as being, oh, this is such a terrible thing. But now they mix heroin with fentanyl and people are dying. The most at-risk age for us, for substance abusers, is 25 to 44. And that happens to be a pretty low risk for COVID-19 patients. As a matter of fact, last year, there were roughly 400 people in the state of Florida who died from COVID-19 in that age group. In substance abuse overdose death, there were 3,600. So you compare 3,600 to 400, but that's in that particular age group. Yeah. And the thing that people do need to remember, some people think that, well, if I have a son or a daughter or a family member who's into drugs, I can't convince them to seek help. They won't do it. I feel there's nothing else I can do. That's not correct, because we do have a statute called the Marchman Act. And if a family member goes to the courthouse, speaks to one of the judges, fills out some paperwork, the sheriff will come pick that child up or that adult, bring them to us for treatment. And I've seen a number of personal experiences where friends of mine followed my advice, did that, and their sons' lives were just turned around. They said they didn't think they would ever see anything good come from this child. So it'll work. It can work, even when it's involuntary. It'll work.
So it's important to stress that people out there need help, and sometimes it's difficult to make that decision, but that decision can save a life, and we've seen success with that. So,
yeah.
And let me talk just about some of the success or survival that you've experienced at Park Place through the COVID. You wanted to talk about PPP. You were able to benefit from that?
Yes. Actually, last year during the pandemic, at the time when things really fell for us, we were headed for the most disastrous financial year that we had ever had. But there were two things that saved us. One was the payroll protection plan. Because we were very close to laying people off because the business was so low. And as soon as we heard about the plan, we thought we reversed our movements there. Nobody got laid off. Even though business was down, everybody had a full week's work if they wanted it and a paycheck. And the payroll protection plan, the funding that we got through that saved us and left us with a surplus for that year. Now this year, we are exploding. We've gone from last fiscal year being a very bad year, and this year is probably going to be the most financially successful year we've ever had. But our history has always been, because we're not an investor-owned company.
Mm-hmm.
So our board of directors, who are all local individuals, community leaders, they always say when things are going good, think of something new you can do. What else can you add? What service can you add that people need? And this year, the choice has been, we applied to the Florida State Housing Authority for approval of an apartment complex, and we have the land to do it. So we just got approved 2 weeks ago, and we'll be starting soon to build an apartment complex. And I know there are a lot of low-income housing projects going on in this county, but this is going to be a very unique one because it's for people with a mental illness or a substance abuse issue. So it's very focused.
And is it really relates to some of our chronic homelessness in a sense?
Absolutely.
Too? Yeah. So.
Yeah. We have a lot of chronic mentally ill people who have a very difficult time getting a job. We have programs for them, which usually are referred to as day treatment programs. They come to us 2 or 3 days a week. We feed them. They receive therapy, group therapy, other things to help them with life. And they're really very good people. They're very good people. And these are exactly the ones that would seek an apartment in our unit that we're going to build. And we are funded. We're funded by the state. We're funded by the county. And Osceola County, by the way, when we thought about doing the apartment complex, they stepped up. The county and the city together committed $1 million to this project.
Mm-hmm.
So it's a $7.2 million project, but it's going to really meet some serious needs for people.
Absolutely.
Get people out of the woods and out of hotel buildings.
And the Chamber's been following that and very supportive of so great to hear that success and the work going forward on that topic. It's been a constant issue at the City of Kissimmee Commission meeting, and our downtown Kissimmee Area Council has been following it. So great news to see you all take that project on. We know it'll help, and so kudos on all of that. You had mentioned the other thing that saved you was telehealth, and that kind of also gives us a look towards the future maybe. So talk to me about telehealth and maybe what the future holds.
Yeah, just a few years ago, telehealth was a futuristic approach to medicine. Now it has taken over. The only thing that kept us going really during the pandemic was telehealth because people did not want to leave their house. If a few years ago, if you would come into our clinic and the waiting room be full of people. Last year, you come in there were maybe 3 or 4 people there, but we could still see people through telehealth. As a matter of fact, even individuals who would come to our clinic, we had rooms set up so they wouldn't have to sit in a room with a physician or a nurse practitioner. They could go into another room, and we'd set up had a nice TV set in there, and and the doctor might just be down the hallway, and they wouldn't be with each other, but he would be able to make a diagnosis. Telehealth is, I think it's here to stay. In the past, there were insurance companies who wouldn't pay for telehealth. They thought the patient ought to be face-to-face. But when we couldn't do that during the pandemic, it became accepted. I think really the cat's out of the bag on that one. I don't believe they'll be able to reverse that. I think we'll continue to see a lot of people. We can see people, they can sit in their home with their computer. I mean, even with a smartphone, which I wouldn't say that's the best way to do it, but you can keep an appointment on your smartphone. Really.
Sure. I mean, if you need the help, and we were talking before that you don't necessarily have to see a boo-boo or a broken arm, and so if you need that help and it's there, this is a great tool that has worked, and so supportive that we hope it'll stay. I think.
Yeah,
right?
It works even much better for psych care than it does for medical care.
Mm-hmm.
Yeah.
Mm-hmm. Anything else in the future on the outlook that you want to discuss?
Well, I think we keep in mind that because of the funding that we get from the state and the county and the feds, we try not to turn anybody away. So, if you have an issue, I know in the past, people with substance abuse issues, they would say, well, I don't have any money. Nobody's going to take care of me. Nobody's going to see me. That's not true. I mean, because of the opioid epidemic, the state has put a lot of money into substance abuse care. Right now, we have 37 clients in our substance abuse program. Only 5 of them have private insurance. So so that means we're taking care of a lot of people who had nothing, but the state is providing a lot of funds for that. So don't think that you can't get in. Give us a call and see what we can arrange for you.
So I know that we had put up the website, and we'll make sure the phone number and website are easily accessible. If you're having a crisis, please seek out the help. If you think someone around you is having these issues, reach out to our friends at Park Place Behavioral Health. They'll help identify. If it's an emergency, call 911. And but you know, there's help out there. People are working every day in our community, Jim and his team, to help people get healthy. You know, the 2 most important things for us humans are to take care of your heart and take care of your mind. And so it's appropriate here in the month of May that we draw special attention to that. It's been a very difficult year as we suffered through the COVID pandemic and isolation at times. So things are getting better, and Jim's team's here to make sure that that's all on track for you. So and there are some great practice tips we'll include in the thread about you know, if you aren't suffering, but you just best practices to stay mentally healthy. We'll try to incorporate some of those tips in the thread for you as well. But Jim, I'll give you some closing remarks before we close out, and I say thank you. Anything else you want to share?
I would only try to impress individuals that better. I mean, a lot of the psychiatric diagnoses can be treated. We have new medications that work well. And with substance abuse, again, we also have new medications there, and we've seen a lot of success. So it's worth trying.
And there should be no stigma. You want to talk about that?
Well, that's always been a problem with mental health, that people feel embarrassed to seek help. But I think that's being overcome now. I really do. Good. And I don't think it's as stigmatized as it has been in the past. So
I'm glad to hear that.
If you need help, seek help. That's all.
Absolutely, yeah. I always held dear to me a quote by Boris Pasternak: "Man was born to live and not to prepare to live." And so make the most of the time you have here on this earth, and surround yourself with happiness and friends. You are not alone. We are here for you at the Chamber. And you've got friends, an extension of that, with Park Place Behavioral Health and other partners in the community to help make sure you, your family, your loved ones are all healthy. So, Jim, thank you for being with us. Thank you for what you do day in and day out in our community. As a reminder, we here at the Chamber are champions for business and community. Park Place shares that mantra, and we'll see you next week. Thanks for being with us.